it is the club's absolute pleasure to have you here on HYS Club. And we are looking forward to a very interesting conversation with, it is called Baal ki khaal. So let us start with, how did you start with your journey as a plastic surgeon? So I was having, one of my friend's daughter, she's into counseling again. And pehle it used to be radio on the top, then so I convinced her ki anesthesia le lo, take a lighter branch, take dermat. But I will do MS surgery and then cosmetic.
I got into medical school only because of my dad. That was his wish. जो सबके साथ शायद रहता था कि डॉक्टर बने, इंजीनियर बने. So I got into medical school, was doing my MBBS. During MBBS days, I started getting some clarity on like what should we do. So one thing was clear. It was again it was by omission, not by commission. That I didn't want to do medicine. I just wanted to get into surgical branches. So then got to do like MS from SMS Medical College again. During MS general surgery days, then when we get these rotatory postings in other super specialty departments like neurosurgery, cardiac surgery, onco surgery, वहाँ illness वाला aspect इतना ज़्यादा था कि वो थोड़ा सा disheartening लगता था, recovery मुश्किल, then so somehow, and I had always been a sportsman. I used to play cricket during MBBS days. लगता नहीं है देख के मुझे, but I used to dance and so वो एक थोड़ा सा रहता था कि हाँ ठीक है, फ्लैम्बॉयंसी रहनी चाहिए. So I started focusing more on that wellness aspect. So which I think then during MS I decided that thing I can get in plastic surgery with cosmetic surgery, which is not the illness part of the medicine. That is the wellness part of the medicine, and it truly transforms lives actually. So then post MCH plastic surgery, I did a fellowship in cosmetic surgery from Calcutta and from Berlin, and then I'm in Jaipur. I basically belong to Jaipur only. Then I started my professional journey from Santokha. I worked there in Santokha as a plastic surgeon for 8 years, then CK Birla for 6 years. Currently I have my own center in Shyamnagar, and I'm a visiting consultant in EHCC as well. This is my professional journey.
So the club wants to know that in this stream of medicine, is it a new development? I mean, is this a new branch, or is it as old as the other branches?
See, whenever we talk about any cosmetic surgery or cosmetology procedure, it's associated with beauty. And beauty, the concept of beauty is not new. It's there since ages. And beauty is an emotion actually, which kind of relieves your senses and provides pleasure to your senses. So वो शुरू से ही चलता था. कुछ पुराने लोग घर की चीजें यूज करके कोशिश करते थे कि कैसे अच्छे लगे. In fact, getting a haircut is also part of beauty.
Absolutely.
So then, but हाँ ये जरूर था कि cosmetic surgery, cosmetology, all these things started increasing, building up after say 1990s or so. Yeah. And then in recent, like past 2-3 decades, it is rising exponentially, catching up exponentially, and the reason is changing lifestyles and yes, social trends.
Right. So now I'm a gynae talking to you, but these questions are from the club through my mom. So what does the plastic word mean in plastic surgery? Is it something to do with plastic? Is what?
Thank you so much for asking me this. Actually, वरना सबने वो plastic वाला joke सुना होगा ना कि डॉक्टर साहब plastic में ले आता हूँ. See, this plastic word in general is derived from a Greek word, which is plastikos. Plastikos ka meaning is to mold, to reform, to give a shape or change a shape. So वहाँ से वो plastikos लेके this plastic surgery term has been coined.
Correct. So it's nothing to do with the plastic thing.
Plastic आपको खुद को लाना पड़ेगा, डॉक्टर नहीं देगा.
So, does plastic surgery have only therapeutic value or is just aesthetic? Is what we are.
See, when we talk about plastic surgery, broadly speaking, it has got two domains. One is reconstructive surgery, the second one is cosmetic surgery. Reconstructive surgery deals with improving forms, functions. It deals with reconstruction after trauma, after cancer surgery, congenital defects. Fine. So that is totally therapeutic aspect. When we talk about cosmetic surgery procedures or cosmetology, It's majorly aesthetic.
Aesthetic, obviously.
Leave aside a few things, say, just to give you an example, if a female is having very large breasts, because of the weight of those breasts, she might suffer from shoulder pain and backache.
Yes.
So if you are doing a cosmetic surgery for her, it has got both the components, aesthetic as well as therapeutic. And adding on to that, see, if someone is getting a cosmetic surgery or a hair transplant done, the reason is the patient is not comfortable in his or her skin. There is some negative psyche developing, there is some low self-esteem developing. So if the procedure is done, this self-esteem can be restored, and it has got a psychological therapeutic value.
Exactly. So, is there any difference between a plastic surgeon and a cosmetic surgeon?
See, the degree which is given by an NMC or MCI is plastic surgery. There is no degree like cosmetic surgery in India. And the person who does cosmetic surgery is termed as cosmetic surgeon. So, again, as I already said, we have two domains in plastic surgery, reconstructive and cosmetic surgery. Those who are doing reconstructive surgeries are primarily known as plastic surgeons, and those who are doing cosmetic surgeries are called as cosmetic surgeons. And then these cosmetic procedures, apart from plastic surgeons, most of the cosmetic procedures are done by dermatologists.
Right.
But they are not called cosmetic surgeons, they call themselves cosmetologists. So, because they are not entitled to do these surgeries.
So I see a lot of dentists also, they come to XYZ, eyebrows and some kind of facelifting and Botox, and that's all okay.
That's not okay actually, but that's a controversial subject actually. We have a dentist who does that.
So, out of all the patients who come to you, what is the percentage of hair related? What is the percentage of other? Also, what is the whose percentage is higher, the men or the women?
See, in my practice, I think around 60-62% of my patients they do come to me with hair related problems, and remaining 40-45% patients with other problems. And out of these, I think 60-65% again are males and 30-35% are females.
उनकी बीवियां बाल पूछ देती हैं।
उसका reason is actually it's God's gift to them actually for being a male.
I know, alopecia. So
it's alopecia, androgenic errors, and God's gift, they should accept that.
And not come to
if they want to transform themselves, then they can come to us.
Of course.
So, talking about, I missed your name, sorry, the last presentation. Shubham. The last slide which you showed actually, we can play that slide in reverse up to the middle part with your hair back in 6 months.
So first patient comes. So then, in your view, if people are with new or different, nowadays, is it the same hair related problem that people used to have, or is the hair related problem changing?
See, I started practicing in 2009. It's been 15 years now since I'm into active plastic surgery private practice. Before that, I was in the government sector. The hair related problems are definitely changing and increasing. And the major reason is lifestyle changes, stress, smoking. See, whenever it comes to, I think I would use it in a broader, I can use it in a broader front as well. For everything, there are two kinds of factors, controllable factors and non-controllable factors. In males, most of the factors are non-controllable factors because hair loss is because of hormonal and genetics. But in females and in younger children, these things are controllable to some extent. And the cases which we are seeing more these days is hair fall in early ages, baldness is in early ages. Because see,
even
the gene,
hair whitening in early ages,
gene is already there in each and every one. But how dominant is that gene, that dictates the degree of baldness you are going to have. Then these lifestyle factors can sensitize the gene further and aggravate the situation.
I wish there was an awareness to this because so we cycle, whenever we cycle, and then we sit at different tapris, including Gulabji, and And these youngsters, matlab, they must be just 15, 16, 17 and they're busy smoking early in the morning. I really wish they knew the long-term effects right away.
See, smoking is one thing which has got there is no, even if you smoke one cigarette, that is hazardous for you as well as the person sitting beside you.
Next to you. Correct. So, what are the 3 most common hair-related problems and what is the root cause for it?
See, if I rank them in order of occurrence, the first one I would rank is androgenic alopecia or male pattern baldness, baldness in males, which is again the major factor, the major contributing factor is hereditary genetics.
Correct.
So we cannot do much about that.
Correct.
We can just delay the progression of that process.
Right.
And second thing that which we see most commonly is diffuse pattern hair loss, which is happening more commonly in females as well as younger children. And that is related mostly to the lifestyle, dietary habits, smoking, lack of self-care, lack of hair care. So that those things actually we are definitely I think most of us are growing, but we are compromising on these things. So that leads to diffuse hair loss, nutritional deficiencies, which can be cured very well. Then the third thing which we see is dandruff. Dandruff actually is a natural process.
Yeah, so it's fungal.
Yes, that again happens because of lack of hair care, poor hygiene, most of the times. It's really part of disease factor.
So children don't want to oil their hair anymore. But then kya naya trend hai oil? I don't know what it is all about. Anyway, so what is the difference between hair restoration and hair transplant? What procedures in what circumstances?
Okay. See, hair restoration is a broad term which is used to define both medical as well as surgical aspects of getting your hair back. It includes all the medical treatments and the surgical treatments. In medical treatments, we have various things like PRP therapy, some medicines, dietary modifications, then lasers, then microneedling. So these are the things which can be used in diffuse pattern hair loss in females and in younger children to restore their hair. And then the second thing is hair transplant, which is a kind of subcategory of hair restoration, which is totally surgical. In hair transplant, we extract hair from one safe zone, from one donor area, and transplant it to the area which is not having hair. It can be any hair bearing area which has lost the hair. Most commonly, that area is the scalp.
So, ये भी डर है कि whatever cosmetic surgery or plastic surgery or hair transplant, people think that we'll have to have it redone. मतलब it will come back to square one. So, what is your say on that?
See, one thing I would like to say on this is, see, growing old is inevitable, but looking young is optional. So, आपको लगता है कि आपको किसी भी समय, and then life में nothing is permanent.
That is true. That is true.
Aging is age is going to progress, skin quality is going to deteriorate, and all these things. Do you know what is the most common factor, most important common thing responsible for this aging? This is gravity. Gravity pulls everything down, skin, breast, tummy, everything.
Exactly.
So we cannot eliminate that gravity from our life. So those things definitely going to see. If we are doing a non-surgical procedure, it is going to last for a slightly lesser period of time, say around a year or so. If you are going for a surgical procedure, cosmetic surgery procedure, if you maintain a healthy lifestyle and good lifestyle, you can sustain it for 17 years, 15 years. For hair transplant, transplanted hair stay there if done properly for lifelong.
So you have to be careful, basically. Yes. And also the debate, today's debate was like, so Rajveer was talking about hair care and somebody was talking about hair experimentation. Experiment is a big no, I feel, because all this perming and chemicals and all is, obviously it should not be done. But to experiment with your hair in, as in cuts and all that is okay. Why not?
See, doing experiment with a bit of research is always good.
It's always good.
Doing experiment without any research, be it any field, leave aside hair, is hazardous. But you should keep experimenting. That's the way you learn actually.
Exactly. but not experimenting with the bleach and the perm and the things that people are doing nowadays. So, how has cosmetic surgery numbers changed in India, and what are the ratio vis-a-vis the world?
See, as Piyush already mentioned, we are ranking around 5th or 6th in the world for cosmetic surgery procedures. And this market is actually going by 10-12% annually.
Yeah, I'm sure because of Bollywood stars, बहुत तरह करते हैं. So,
and then India, and then इसमें भी 10% जो total लोग last year around 8 to 10 lakh cosmetic surgeries हुई हैं, surgeries, not non-surgical procedures, उनका नंबर तो बहुत ज़्यादा है. तो वो उसमें भी around 10% लोग ऐसे हैं जो बाहर से आए हैं. Medical tourism.
Yeah, that's because it's cheaper.
Yes,
yeah,
because affordability है.
Yeah,
they can rely on Indian doctors very well. वो trust पूरा उनका है. पूरा ट्रिप में पूरा कॉस्टिंग मतलब एक जैसे कहते हैं ट्रिप का कॉस्टिंग में सब कुछ हो जाता है.
Exactly. Even cosmetic gynec ना. So people come from UAE and all to us. So also since this problem in the stream of medicine is not commonly discussed, I mean it's a hush thing. So how many people come to you and then back out, or how many people they have, what are the myths, what are the apprehensions that these guys face?
The most common myth is everyone is scared of side effects and the safety issues. So again अब ये मैं बहुत छोटा सा इसमें एक लेमन लैंग्वेज में कोट करूँगा कि अपन ट्रैवल करते हैं ट्रेन में, कभी कोई जाके नहीं पूछता कौन प्लेन चला रहा है, कितना क्वालिफाइड है, कितना एक्सपीरियंस है, क्या साइड इफेक्ट हो सकते हैं, ट्रेन के बैठने के कितने % चांसेस हैं. I'm sorry but ये चीज़ क्या डॉक्टर के साथ जाके सबको याद आती है. Medicine is nothing but medical branch altogether is nothing but weighing risk benefit ratio. Each and every medicine is a poison potential. In fact, everything is a poison if consumed in an excess. So medicine is to extract beauty out of these poisons and using them in a proper proportion. तो और उसमें फिर ऐसा होता है कि वो हर बॉडी अलग रिएक्ट करती है, तो कभी किसी को छोटा मोटा कुछ प्रॉब्लम हो सकता है, किसी को कुछ हो सकता है. बट अदरवाइज ये ब्रॉड मेडिसिन के लिए हो गया. बट कॉस्मेटिक सर्जरी प्रोसीजर्स बिकॉज हमारा काम इंटरनल ऑर्गन्स से किसी को हैंडल करना है ही नहीं. इट्स ऑलमोस्ट लाइक हमारा सारा काम लाइक पिंचिंग द स्किन. So if done properly by a qualified, experienced doctor, these are one of the safest procedures. And जो भी experienced cosmetic surgeon होते हैं वो सबसे पहले assess करते हैं patient की fitness. उनका रोज का काम ही है. उनको ज़्यादा चिंता है कि patient को problem नहीं हो. So that prime requisite is patient's medical fitness before procedure. If patient body can take the procedure well, कोई problem नहीं आता है. So this was the myth, which is again most of the people carry the side effects और ये सब होता है. बट अगर ढंग से हो तो इट्स नेग्लिजिबल. ठीक है. देन सेकंड थिंग आपने बताया रेजिस्ट करते हैं, उसके लिए मैं छोटा सा ये मेरा ऑब्जर्वेशन है पर्सनल एंड नॉट अ काइंड ऑफ सेक्सिस्ट और समथिंग, थोड़ा मेल्स को ऑड लगेगा सुन के. मेरी प्रैक्टिस में जब हस्बैंड वाइफ साथ में आते हैं तो 70% टाइम्स एंड फीमेल इज कमिंग फॉर अ प्रोसीजर, इज प्लानिंग टू गेट अ प्रोसीजर डन, 70% टाइम्स मेल का कोशिश ये रहता है कि डॉक्टर साहब तो ये बोल दें कि इसको जरूरत ही नहीं.
दिस इज सो ट्रू. तो जैसी वैसे अच्छी है,
एंड कितना भी फीमेल्स क्वालिफाइड हो, कितना भी हो दैट सेल्फ डिपेंडेंट इंडिपेंडेंट हो, बट ये बहुत एक चीज़ हम प्रैक्टिस में देखते हैं कि और मेल कितने एंड दैट तो बहुत अच्छे जो बिजनेस फैमिलीज के लोग आते हैं वो कि जैसी भी अच्छी है, जैसी भी अच्छी है. पहले तो क्या रहता था कि जयपुर में रीजन नहीं कराने का, रजिस्ट करने का तरीका क्या ढूंढते थे कि जयपुर में अच्छा नहीं होगा डॉक्टर साहब बाहर भेज दीजिए. आज से 10 साल पहले कि आप हमें सिंगापुर बता दीजिए या बाहर बता दीजिए, तो कहाँ कौन जाएगा कराने. बट अब आजकल ये हो गया है कि आप तो कैसे करके कन्वर्सेशन को इस तरह से मॉडिफाई करते हैं कि कैसे भी हम बोल दें कि साहब इनको जरूरत नहीं है. सो
वेरी ट्रू.
ये एक रेजिस्टेंस सपोर्ट का एक्चुअली अगर someone is not happy within his or her own skin and psychological impact एक लेवल तक आता है, not excess, but तो बहुत अच्छे से मैनेजेबल है with all these procedures and everything.
हाँ, if the lady wants to have it done, it will increase her self-esteem. It's okay to have it done.
अच्छी चीज सबको अच्छी लगती है, बुरी चीज सबको बुरी लगती है.
मतलब गोलगप्पे खाने जाएंगे ना, उसमें तो साइड इफेक्ट नो विल सी, बट मेडिसिन का ये क्या साइड इफेक्ट, इसका क्या साइड इफेक्ट, अरे भाई स्पेयर अस. So a very important question is what is your final tips for hair and skin care? All the years should be up now. What do's, what don'ts, what do you say?
Yes, I would like to share just 2 do's and 2 don'ts. First of all, the do's is stay as close as possible to nature.
Nature.
है ना? जितना डेविएट करते जाएंगे, नेचर आपको परेशान करेगी। That's a basic thing. And second, basic self-care, basic skin care, basic kind of dietary consultations. अपन सबको लगता है कि हम सब experts हैं, मतलब सब हैं, but मुझे अगर कुछ फाइनेंशियल काम होगा, फाइनेंस रिलेटेड, तो मैं सीए के पास जाऊंगा, कुछ हेल्थ रिलेटेड प्रॉब्लम होगी डॉक्टर के पास जाऊंगा। और तो उस जैसे डाइटरी अपन बहुत सारे कई बार डाइटिंग कर लेते हैं या कुछ कर लेते हैं और कि मेरा एकदम से वेट कम हो जाएगा, ये हो जाएगा, नहीं, उसके लिए यू नीड टू कंसल्ट अ प्रॉपर डाइटिशियन। सो द होल आइडिया इज कि प्रॉपर डाइटिंग और प्रॉपर आप अपना हेयर केयर, सेल्फ केयर करेंगे तो सब चीज़ें बहुत अच्छा लंबा टाइम तक मेंटेन रहेगी। इसमें जस्ट एक मैं चीज़ और ऐड करना चाहूँगा डूज एंड डोंट्स में। अभी देयर वाज रिसेंटली अ पोस्ट ऑन सोशल मीडिया अबाउट करिश्मा कपूर ही है, करीना कपूर। सो शी पोस्टेड दैट आई एम 44 एंड आई स्टिल लुक सो यंग दैट आई डोंट नीड बोटॉक्स, फिलर्स एंड एवरीथिंग। सो सी अब कंपेयर करें तो शी इज जेनेटिकली सो ब्लेस्ड।
Yes.
Number one, her skin is so blessed. Then she has been taking care of her skin and everything for so long.
Because that's a profession.
Yes. So वही चीज़ वेरी करती है पर्सन टू पर्सन, बट यस अगर वो चीज़ें सब करते रहे डूज में तो आप बहुत सारी चीज़ें आगे अवॉइड कर सकते हैं। डोंट्स में थोड़ा सा ये है कि लाइफस्टाइल एक रेगुलेटेड रखना है, थोड़ा स्ट्रेस रेगुलेटेड रखना है, देन ये जंक फूड वगैरह नहीं खाना है। एक्सपेरिमेंट्स पे मैं कमेंट करना चाहूँगा कि आप ये दीज आर नॉट एक्सपेरिमेंट्स एक्चुअली, कि जो अपन बट एक्सेस अगर अपन उस चीज़ का कर लेते हैं तो वो डेफिनेटली एक्सपेरिमेंट एक ज़्यादा चीज़ हो जाती है। तो एक लेवल लिमिट तक एक्सपेरिमेंट करें, उसके बियॉन्ड अपन नहीं करें। एंड देन स्मोकिंग अगर कोई करता है तो वो तो बिल्कुल ही नहीं, दैट इज अ लाइक रेड फ्लैग फॉर हेयर एंड स्किन। वो आपका एजिंग को प्रीपोन कर देगा हर तरीके से
एक्चुअली, बिकॉज I mean, for my field, it's sperm count goes down. Everything. Smoking, drinking is like.
I think सबको पता भी होगा कि this tobacco releases a substance nicotine, and what it does is it reduces blood supply to almost each and every part of the body. So वो एक भी स्मोक कर लिया तो वो इतना नुकसान कर देता है कि वो नहीं मैनेज कर सकते उसको।
Very true. So thank you so much, Dr. Sunil, for such a lovely information.